This is Optometrists Building Empires, and I'm your host, Ankit Patel. Each week, we'll explore the journey of multi-practice ownership and leadership in optometry. Join us for insights and strategies from the top minds in our field. This show is sponsored by My Business Care Team. My Business Care Team helps your office increase revenues, reduce costs, and reduce staffing headaches. Let's build your empire together. So today's guest is another impressive doctor. He's a practice owner and a CEO. He specializes in contact lenses, macular degeneration, pediatric eye care, and medical billing. He's earned prestigious fellowships in the American Academy of Optometry and the Scleral Lens Education Society for his work with specialty contact lenses. He's the owner of Clarity Vision of Apex and CEO of the licensing group. And he's also a co-founder of Clarity Vision. Please welcome Dr. David Holler. David, welcome.
Thank you for having me.
Yeah, you've got a pretty interesting background. I'm excited to dig into it. You bring some unique talents to the space, I think. And my first question that I love to ask is, what's the most important thing that helped you grow your empire?
Most important thing is to put time on the business. And as some like to say, not working in your business, but working on your business. So from the very beginning, I tried to make sure that I had a dedicated admin day. And on that admin day, I'm specifically working on the practice, training, hiring, things to develop the business and not just getting absorbed in patient care.
Now, I want to ask you a question. This actually happened to us. My wife's an optometrist. I brought this up to my wife. I was like, hey, we need a training day. We need to forget half day, one day. We just need to shut down the offices and just do that and work on the business. And she had her rep tell her, what are you talking about? You guys are mom and pop shop. You guys just need to be open and getting people in the door. And I'm like, I think this will help us. And so we ended up not doing that. So tell us how you made that hard decision to say, I'm not going to see patients and I'm going to work on the business at this time.
Well, yeah, I think what happens is people have this notion of, I've got to get out of this position I have of moonlighting all over. And, once my practice is ready, I'm going to be in there all the time. And, it's important. You have to have a steady income. You have to pay your loans. You have to have a place to live. But honestly, if you could spend more time on just simply, how can I grow what I'm working on and put time into that activity, I think it's super important. Training is part of it. If you're lucky enough to have somebody covering the practice while you can spend time doing that, even hiring somebody to work just that one day a week, I just think that it's a small investment. It's like taking one step forward one step backward in order to take two steps forward.
Can you think of any specific tangible outcomes that came directly from that time you had on the business?
Well, we had something actually not that long ago where we were trying to develop an eyewear warranty program. And, for a long time, I just thought, having an eyewear warranty, shouldn't we be selling products that have something built in? But then I realized that there was a lot of opportunity to help patients feel, okay, well, if I break this frame, I'm covered because I have sort of this little small investment that I paid in a warranty for that. And so try to put something together that has, internal marketing, external marketing, a presence on your website, training all of the team in the office, not just the opticians, about why this is good for patients, why this is good for the practice. And, 45% of our patients in the first 3 months all elected to be on that program. Wow. Because we came up with something that we started with a why, and then we developed it before we released it. We weren't learning as we were going. We really said, let's make some goals. Let's make sure that people understand why this is good, and let's develop this protocol.
That's pretty interesting. It's pretty good adoption rate too. And
yeah. Well, and we're basically, we started it in one location and then we've added it to 2 other locations. And, we're working out the kinks in terms of, do we want to have a quote sheet where we can quote a patient's frame and lens benefits, and then we add this at the end? Do we incorporate this at the beginning as this, don't worry, everything's covered, because you're going to be on this program. So there's different little tweaks and wording but it's been kind of a no-brainer at this point. And, they could be if you're bringing Optos or wide field imaging into the practice, if you're trying to promote annual supply sales, sit down and create a program, create training, have some sort of mock interview that you can do back and forth with employees to make sure that they understand how to present it. And this is what you need time to do. You just can't do this if you're seeing patients every 15 or 20 minutes all day.
Yeah. Now, you took an interesting path to growth, and I'm going to let you kind of tell your story of how you have the licensing group and your locations. Can you tell us about that journey and how you got
Yeah.
there?
So in North Carolina, we had 3 big groups. These 3 big groups had 25 or more locations. And we were a licensed location, and there were several others, and we would get together and we would talk as part of this group, and try to get an idea of what we're getting out of this, what could be better about being in this group. And we started to realize that the owners of our group, as well as these 2 other groups, were all 65 years old, 70 years old. There was going to be a time that independent optometry was going to be similar to other states, where maybe there's either, corporate locations or independent, but there weren't these groups of independent practices that had a common name or something that bound their practices together. So we decided to create Clarity Vision, but we wanted it to be something that was very transparent among all of the owners, that it was something that we called a cooperative or sort of a collective rather than like a franchise group. And you could be, Clarity Vision of Clayton, or you could be Mills and Matthews, a member of Clarity Vision. And this would be an association where people understood you're part of this group, but yet you're still operating your practice independently.
Okay. That's pretty interesting. And I think why that particular route versus like a traditional, like, hey, maybe I'll just open up a bunch of cold starts or this, yeah.
Well, we had already been part of, a group where we had very little say in the direction of where this group was going. We were happy to be maybe a licensed location, but we didn't have any influence. And then there are other models of, let's say, like a Vision Source, where you could still operate on your own, but again, you had no choice of vendors. You may have these 2 key contact lens vendors that support your group, and then the next year it could be different companies. So we wanted something that we were all a part of, that we could sort of move the needle together. And we could show that as a group of locations, while we may be independent, we can make decisions together and we could move the needle. We could move share as somebody that's all buying into the same idea.
Okay.
And so sometimes vendors will come to us with ideas. Hey, we want to work with your group. And if we can't really get everybody on board, then it's just not gonna be a good partnership for us.
Interesting. So as you were went through this process, kind of getting everyone together, what are some things you ran into that you didn't expect? Like we're like, oh wow, didn't expect that to happen.
So I didn't expect that some people really want someone to run their group, or run their practice. They're looking really for more of an MSO, somebody that they can pay a fee and they can take care of everything for them. And we weren't really expecting that. We thought of ourselves more as independent. We wanted to have sort of this autonomy, but yet we could pool our resources together. And so we definitely found that there's some people that are interested in more of a MSO model, where somebody can take care of all your billing, can take care of all of your payroll and do all those things. But we wanted something a little bit different.
Interesting. Okay.
And so and also exit strategies. So there's some practices that are interested in joining a group because they feel it's a way that somebody can buy them out and they can have an exit strategy as well.
Yeah. And their $1 or so practice becomes worth more now they're part of a larger.
Exactly. Multipliers of EBITDA.
Yeah, exactly. For folks who don't know, EBITDA is earnings before taxes, interest, depreciation, amortization. Basically, that means what's your most people do cash basis accounting anyways. So optometrists don't do it. So it's basically whatever your profit is, roughly ish. If you do a true P&L, you have other items in there, but yeah, uh, most people pay off of traditional private equity. People pay off of EBITDA or that's how much they count you made money. So, I think if between in the optometry field, there's a lot of different ways of valuing. Some people base off of gross, some people do it other ways, but it all ends up being roughly about the same number, no matter how you slice it.
Sure.
So as far as um, what what was a drive you like? What do you feel like drove you to go this path in terms of uh, was there like a seminal moment? You're like, no, this is the way I gotta go. You always knew you wanted to do
Yeah.
this, or tell me about that a little.
So here's one way that I looked at it. A contact lens vendor will have a rebate program. And on this rebate program, they'll have all of these tiers. And let's say there's 5 tiers. And you say, wow, geez, if I was, doing $100,000 in contact lens business with that vendor, I'll be getting 12% back. Well, if you think collectively, if you were, working with other independent practices, you'd automatically be there.
Hmm.
So you could have one practice that's really kicking butt and you're in that highest tier, but you're not going to be in with every other contact vendor, or you're not going to be in other areas. There are going to be strengths and weaknesses. So I realized that no matter how hard you work in one practice, there's a limit to how you can control your cost of goods. There's always going to be a limit of how much one practice can do. And if you could unite your efforts with somebody else or with other locations, then you could all help each other out. You're basically pooling your resources.
Yeah.
So we realized early on that we were kind of in the highest tier of any sort of vendor negotiation that we would have.
Yeah. And as far as what you kind of see as challenges, like what are some challenges you're facing right now, even though you do have buying power, there's a whole lot of stuff going on in the country right now, outside of just normal macro factors like staff costs, things like that. What are some of the biggest challenges you're facing?
Well, in our particular group, a challenge is still that, we're not a dictatorship.
Yeah.
In a dictatorship, one person says, this is what we're going to do. This is my vision. And so sometimes when you're coming to a decision as a group, decisions can be made a little bit more slowly, more collectively. It could take a little bit longer to get things moving. Once everybody commits to it, then it's full steam ahead. But optometry, independent optometry is such that we like not people not telling us what to do. So when all of a sudden you have to try to think as a group, then some of those things can move a little bit slower.
Okay.
But one nice thing is challenges and bouncing those challenges off each other. Feeling like you can talk to somebody that is not a competitor of yours and see what they're doing to navigate, tariffs or, whatever concern we have. Are you going to have a line item? Are you guys charging your patients merchant fees? Or are you absorbing that yourself? And, you may have what you think is a really good idea, and then it only takes 1 or 2 sentences from someone else to make you realize, wow, good thing I didn't do that.
Yeah. 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 It's interesting because like even I think that's one of the common themes we hear from folks on this call, on these podcasts, that I had a group of people to help me and I can bounce ideas off of. And sometimes it'll be something completely different because they have a completely different business model than you, but it's understood the difference there. And now you all have like lots of people you can pull on and bounce ideas off of. Like, hey, you could imagine you could just go in. If I'm a rural practice, let me find other rural practices and see what they're doing. Right. If I'm in.
No, exactly.
Yeah.
And we do it across the country and try to be a part of focus groups where we can, learn from groups that are in similar size to us, but in different markets, and find out how they tackle some of these challenges as well.
Gotcha. Excellent.
Yeah.
Cool. So as far as staffing is a common challenge with folks, billing and reimbursements, are you able to use your negotiation power to help in any of those areas for folks?
Yeah, we had one vision provider that we negotiated as a group. We didn't really like the lab that we were being forced to use. And I really took objection to having a contact lens formulary. I just said, there's absolutely no way I'm going to do that. And we were able to go to this provider and say, look, we represent a pretty large number of lives in these regions. And we feel that we could provide better service to these patients with our own lab network, and by giving patients freedom of choice with contact lenses as well. And we were able to do something as a group. It's exhausting. It takes a lot of time. It would be nice to do that with every vision provider, but it takes a lot of time and time away from patient care too.
Yeah. How about staffing? Do you guys have challenges with staffing at all? Like, how do you guys help with
Yeah,
that at all?
yeah, and that can be such a regional thing.
Yeah.
We have 3 practices that are a bit larger markets, a little bit retail heavy. And then we have 3 practices that are in smaller, more rural areas. The payroll is entirely different from one town to another. And some people, there's only so many people they're going to have apply to a position, and they're pulling from multiple counties. And so there are big challenges that I never really noticed before COVID. And just when I felt like, okay, we're past that, people getting back to work, there's still people that have this dream job of being in healthcare and working from home. And there's limitations in eye care to doing that. And, they want to have sit at a desk and have a picture of themselves that's there and doing whatever else. And it's just hard to get people in and motivated. And the constant challenge of people leaving because of $1 extra an hour or what they perceive as better hours. And so I don't see it changing. We're too dependent on our team. And I think we're all working in a direction of while I've always said we're very patient centric as a business, as a practice, we have to be a little bit more team centric to keep the people that we have.
Yeah. Yeah. It's, and I think it's a tough challenge for a lot of folks out there. I don't know if you guys any secrets that you're working through or not, but it sounds like you guys are struggling just like everyone else.
Well, yeah, it's the usual. You pay a fortune on Indeed. You hope that half the people you offer interviews to come and show up to the interview. You start looking to see if they can talk and if they have a pulse. But then the next week you have a nice selection of people. But no, I haven't seen any great places to get talent.
Yeah.
And in North Carolina, we have an exceptionally difficult time getting doctors.
Yeah.
So, we're lucky enough to have 22 doctors in our group, but that was a challenge, even getting that many. And it's, we could use to have a couple more, but our state has an oral exam. So despite 3 national board exams, they have to sit before a committee and have an oral exam. So that makes a challenge getting more people here too. So from upper management, doctors to those who answer our phones, we have leaned on virtual scribes and virtual front desk support. But it's hit or miss in different markets. If they can't understand the person on the phone, that may go okay in some places, but not in others.
Oh, yeah. Yeah, we have similar interesting challenges. You can tell, like rural Midwest tends to be tougher for folks because they're not used to hearing different accents. But it can be tough.
Yeah, we're reasonably culturally diverse, just like in Atlanta where you are. You've got a pretty nice culturally diverse demographic. But you get a little farther away from the bigger cities, then you have a little less of that.
I'm curious, with AI coming out and how that rolls out, what that's going to be like. We've been testing that in our offices, and it's not a great experience, right? People, even if it's not someone in the office, they still like a human for the most part when they talk.
There's an AI version of me on our website
Yeah.
talking about Shamir driver intelligence lenses.
Yeah.
And I still get a kick out. I put it up on the website because I thought it was fun to watch, and maybe somebody will get amused by it. But I think AI might have a really good presence in scribing. So I'm excited to see how they continue to develop that.
Yeah, I think so too. We'll see how it goes. I think it's coming fast, so it'll be fun to see how that progresses and how patient care gets help with it.
Yeah.
So, kind of on that note, what are you most excited about for your businesses and the field in general?
Um, I think that everybody's going to be tackling an incredible amount of growth. I think struggling independent optometry is not likely going to be something for a while, where we have an aging population, an increasing number of people covered with medical benefits, and we're not really adding providers. And I mean, I'm talking, medical providers. They're not adding medical schools. They're slowly adding optometry schools. We have 2 optometry schools opening in the next year in North Carolina. But I don't know how we're going to tackle the massive population of people that are going to be needing cataract surgeries and advanced eye care. So I think we're going to find optometry expanding to be able to handle those demands, and we may see development of other support professions to try to meet the demands of the population in the next 20, 30, 40 years.
Kind of like the mid levels, kind of developed out of nursing and doctoring and PAs, and
Yeah,
that's
I
gotten much
mean, it
larger.
doesn't seem like there's enough
Yeah,
PAs, and they're cranking them out like crazy,
yeah,
and the salaries are I don't know, maybe double for when the time I was in college. So I think that you're going to find a big lean on optometry, a big lean on PAs, and medical doctors, and maybe even optometrists will become more medical managers at some point or another, and lean on technology and support to get through all of these patients.
yeah. So I think you're actually the second person I've talked to in the last couple of weeks that actually mentioned the expansion of scope for optometrists, and that's very optimistic from state to state.
Yeah, I think it'll go faster than people even think.
Yeah.
We have all the statistics on our side to expand our profession. It's just a matter of how each state has good leadership to really push the envelope.
Yeah, and you hear the other last few years it's been like, oh, people are destroying a profession. In Georgia, you can do remote eye exams. We're still here. We still have great business because those remote eye exams are tough. Refractions are tough remote. But I think you don't hear about the other side as much, like you had mentioned. So that's really encouraging and exciting. And as far as you all are going, how are you positioning yourselves to take advantage of that? Is there anything you're doing in particular now that sets yourself up for success, or how are you thinking about that growth?
When we started our group, we have this slogan. It's tomorrow's technology for today's clear vision, and it's trademarked.
Yeah.
But the whole idea was that we've all sort of embraced technology, and we're in Research Triangle Park. We have 4 practices around Research Triangle Park, so we have a lot of innovation and technology that comes out of this region, and that means our patient demographic are people that appreciate it as well. So I think that as long as you position yourself as being technology forward, then you're going to be getting the types of patients that you want to see, and you're going to be prepared to hopefully take on this type of growth. We have practices in our area that have 6 to 9 month wait lists in order to get an eye exam. And, those doctors must be doing a bang up job, but I mean, they're not really planning, I don't think, for continued growth. And how do you handle the need, the demand? So hopefully you keep looking at your books, seeing what your capacity is, looking at expansion ability, look at how efficiently you're seeing patients. What can you do to be able to work patients through the practice more efficiently? Are you delegating refraction? Are you using automated phoropters in a way that can help you work through patients more efficiently? So I think practices that are trying to think that way are going to be in a better position.
That's good insight. That's really good insight. I appreciate that. Yeah, you don't hear as many positive messages, so that makes me really encouraged about where the field is headed.
Well,
You're
that's
the
always been
people.
true with optometry. We're always killing ourselves about something that never seems to be an issue years later. So
I think Yeah, and it seems like, but I do think that optometrists, at least from what as far as I've been in the industry, really care about the patients and the outcomes as a whole. So I think that's
Right.
exciting to see that there's alignment with the patient needs, where the market is going.
Well, we all have experience with maybe a patient who had a cataract. We sent them for cataract surgery. They have a wonderful outcome, and somehow we get credit for it. We didn't do the surgery, but yet everybody says I should go here to Dr. Holler because he has me seeing like when I was 20 years old again. And so it's that relationship that we have with our patients. And if we can continue that trust, um, yes, people will keep going to optometry, and these threats that we seem to have somehow seem to work themselves out. I remember patients saying to me that I was going to be replaced by a laser. And to
Okay.
this day, everybody seems to think that if they ever need glasses, all they need is a laser and they won't need them anymore. Well, who's going to operate the laser? Who's gonna figure out exactly what your correction needs to be and manage complications? Yeah, I guess they don't understand all those things.
Yeah, it's funny you say that because it's like, oh yeah, you're gonna be replaced by AI, right? That's the biggest thing now.
Right.
Yeah, cool.
I don't think so.
I don't think so either. Yeah, I think there's a lot of it can be taken, probably be done, like some of the things, but I think there's a lot of that human connection that it's gonna be hard to take away, especially with
I
medical
agree.
care. Um,
Yeah, and I think we're seeing some of that with remote eye care, and that there may be all these people that are doing it, but they're coming back to tell me that it wasn't the experience they hoped. So I don't know that that's really going to impact us like people might think.
yeah, yeah. Well, we'll see. Hopefully that's the case. Um,
Yeah.
let's shift gears a little bit. You have a really unique way about thinking about the business and about the field. I want to know, where does that come from? Like, what makes you you? Like, can you share with us a story or two that was really formative for you? It could have been when you were a kid, could have been older, but something that really resonates with you.
Yeah. Well, not to go into too long of a background, but I was in the School of Design in college,
Okay.
and I was doing medical illustration. And I got interested in medicine through thinking with the opposite side of my brain. So when I was interviewing at optometry school and they said, you have a biochemistry degree and you have a graphic design degree, you know, I said, yeah, I was taught to think convergently and divergently. Biochemistry, there's one answer. And in design, there's many answers. There's many ways to look at it. So I think that I've always been just sort of trained to not find one solution, but to find many different paths to something. And I think that's helped in some business instincts. So I always try to put myself in the position of of the patient as well. And so whenever someone says, "Oh, you need to have 300 best selling frames," you don't need to have an inventory of 1,000 frames. We tripled our inventory when I read this article because I thought, no, wait a second. I don't think I want to go to a place that has 300 frames. I don't want to see 2,000 frames. Um, but I need to have somebody that can help me understand what I should be looking for.
Yeah.
So again, that human interaction is still super important. And
Yeah.
so there are some dogmas in our profession about you should be doing this and you should be doing that. I definitely question most of them. And I try to think of what is it as a consumer I should be thinking, not as a business owner. And that helps me to make some of my decisions.
Interesting. I like that zig when everyone zags. Um,
Yeah, maybe I'm a rebel,
that's what it is.
maybe I'm anti-establishment sometimes, but it seems to have worked okay for us.
Nice. Well, what do you, if I had to put you in a corner and say, what do you think some of the common things you think is not, the counterintuitive things that you believe that people, that everyone else believes is just fact and true, that you believe like, yeah, no way, I don't like that at all. Like, what if I asked you like maybe one or two things that everyone believes in the industry is like, hey, common fact, but you're like, no, I don't really think that's true. What would those be?
Okay, well, one thing has to do with contacts. 80% of our practice is daily disposables. And, in the industry, 20 years ago, 10 years ago, even was saying, you need to get your patients out of 2-week lenses and into monthly lenses. And during that time, I thought daily just made more sense. They were more comfortable and more convenient. Now the industry's gone towards that, but our most loyal patients are that other 20%. 80% of our patients in daily disposable contacts can buy their contacts anywhere. And so I think that there's a lot to be said about specialty lenses, offering, multifocal lenses to patients that didn't know a multifocal lens existed, um, doing orthokeratology, myopia management, fitting scleral lenses for dry eye, for people that are demanding of more. And so those are some of our most loyal patients.
Yeah.
So I think that, you can't just think, oh, everybody needs to throw their lenses away more. No, there's a pretty solid market for specialty lenses as well.
Yeah, that's actually interesting insight, right? Um, and so, uh, what what do you feel is someone starting off new? And this is kind of a play on the last question I like to ask, right? But someone starting right now wants to get in private practice. What are some of the main pieces of insight and advice you would give to them?
Um, Make your practice as patient centric as you can. Be available, when people are looking to get an exam. Have evening hours, have some weekend availability, and make sure that you're differentiating yourself. Make sure that you have a real passion for something in our field, something that you really enjoy. And if you have a passion for treating glaucoma, great. Make sure that's known in the community. Make sure primary care doctors know that this is something that you treat, and keep it very grassroots. Be involved in the community so that people know who you are and what you do. And if you're just the eye doctor that sells glasses, that's a wonderful thing. But I think that you've got to have a little bit more focus.
Interesting. I like that a lot, actually. And then some of that stuff is counterintuitive. It's funny. I had other folks on that said, "You know what? No, just take away nights and weekends. We'll just be fine." So it's going back to that.
Yeah,
Going to
no, that's
yeah,
completely true. And maybe those practices retain staff better than we do, but I don't think so. I don't think I think that it's helped them in some cases, maybe, but maybe not grow their business.
yeah,
So obviously, it's kind of a find a balance. We want to make everybody happy, but if you say this is what we're going to be as a business, we're going to be available to our patients. We're going to have these hours, and before you bring in your team, they understand beforehand this is what we do. We're available to our patients. Then I think that's good. When you immediately add all these things to people that didn't sign on to that when you hired them, that's a different story.
yeah. That makes sense. Um, so let's reflect a little bit. And I'll ask you this question: knowing what you know now, let's go to a week after you graduate OD school. What advice would you give your younger self? What you know now?
I think I would recommend that you're very selective in where, well, first, the best thing I've always tried to tell people is when you get out of school, you don't have to take one job. Everybody puts all their eggs in one basket, and they want to get this one job that's going to pay them this guaranteed salary. And it's a roll of the dice if you're even happy living in that area, if you like the patients, if you get along well with your team. You don't know any of those things. You're putting it all into one basket. And so I've had a number of interns, and I say, look, you put together a schedule, find yourself 2 or 3 different places that you work and see what makes you comfortable. See what inspires you. And if you find that direction, you're gonna develop that. So it may be that you like an OD MD group setting. It may be that you enjoy working at a VA, or it may be that you find yourself more passionate about pediatrics than you thought you'd be. But when you get out of school, you have such a limited experience with any of those things that I think people really limit themselves by just taking this one job that's in an area they like, that has this guaranteed salary. And you could be an independent contractor and divide your time between 2 or 3 places and probably end up finding that one job a lot easier through that little bit of experience through 1 or 2 years.
Yeah, it's actually pretty good insight. I like that a lot.
And you're a lot more hireable too.
Yeah.
Now you've got some experience. People know, that you know exactly what you're doing and that you're not right out of school. And it's a gamble for a practice to pay somebody, $150 to $200,000.
Yeah.
And they don't really know how to manage patients and billing and all the other stuff quite yet.
Yeah, it can be tough. I can speak from both
Yeah.
sides of that equation for at least my wife's perspective and from our practice perspective. Well, so, David, I appreciate it. Now, just some last piece of, I guess, insight for us, or if people wanted to find out more about you, where can they connect with you? How can they get connected with you?
Our website is findclarityvision.com. Find like you're looking for something. And on our website, you can find me. I'm one of the doctors, and my contact information is there. And I'm happy to talk to people who are looking for finding a way to navigate independent optometry. That's what I'm most passionate about. Hopefully, we can have more practitioners out there, people that are wanting to sort of not pay rent, but rather build a mortgage in their career that has value over time.
Yeah, I think that's great insight, and we'll put this all in the show notes for folks to get connected with you.
Sure.
And so, thank you again, Dr. David Holler, for being on the show.
And thank you.
And thank you, audience, for listening. If you learned something, laughed, or just enjoyed it, please subscribe and share with your friends, either the video or the podcast. And thank you again, David, for being on the show. This has been another exciting episode of Optometrists Building Empires. We'll see you next time. Take care. That's a wrap on another episode of Optometrists Building Empires. Thanks for joining. For show notes and more, visit buildingempires.live. This show is proudly sponsored by My Business Care Team. My Business Care Team was born out of staffing challenges my wife and I faced together, managing multiple optometry locations. We refined our approach at Classic Vision Care and now offer our expertise to others. If you're experiencing challenges with staffing and you'd like to set up a discovery call, we'd be happy to help you and connect you with the right resources. We'll see you next time.